Diabetes is a chronic disease that occurs either when the pancreas does not produce enough insulin or when the body cannot effectively use the insulin it produces. It has readily become an important public health problem as one of the four major non-communicable diseases. Globally, a whopping 422 million adults are living with diabetes, a number that has quadrupled in 3 decades. In 2012, it was the cause of 1.5 million deaths, and the statistics show that it has contributed to an even larger number of cardiovascular deaths and renal failure.
Today, the Pan American Health Organization is reporting that 1 in 12 persons, some 62 million people, live with diabetes in the Americas. The number has tripled since 1980, and diabetes is currently the fourth leading cause of death in our hemisphere, and more than half of a million people die from it each year.
The national capacity to prevent and control diabetes, as assessed in the 2015 NCD Country Capacity Survey, varies depending on the region and the country income level. In Belize, diabetes and obesity are most prevalent, says Director of Health Services Dr. Marvin Manzanero, who spoke on the epidemiological profile of the country.
The last CAMD study done in 2012 says that we have a 13.7% prevalence rate. However, our data that we are collecting routinely and passively suggests that we may be having much higher numbers than that. The Caribbean region is primarily affected. We are having estimates that by 2030, Latin American Caribbean region would have had a 142% increase in total numbers from what we had just 16 years ago in the year 2000. So that is the reason why it remains a concern for us. And perhaps more importantly is that all the complications that can arise as a result of diabetes. Primarily, it's one of the leading causes of blindness in Belize. It is one of the primary contributors to kidney failure. The amount of hemodialysis that we get done and people needing hemodialysis increasing exponentially. And it is a primary reason why people also develop cardiac dysfunction or myocardial infarctions, strokes, and entities such as that. So it has much more than just a simple diabetes as we normally know it.
Diabetes is a leading cause of visual impairment and blindness, known as diabetic retinopathy. It is caused by damage to the blood vessels of the light-sensitive tissues at the back of the eye. It's a frightening reality because this type of blindness cannot be reversed, and it has been affecting children.
Increasingly, we have found that younger people are coming into our clinics with symptoms of diabetic retinopathy, with visual loss, reduced vision, who don't even necessarily know that they're diabetic. And one of our visiting ophthalmologists, who comes very frequently, about 3 years ago, noticed this trend in the first week that he was in the clinic. And he said, you know, I've been here for 3 days and I have diagnosed 7 people with diabetic retinopathy who did not even know that they were diabetic. So we felt it was very important to come together and increase our efforts, because we've always been providing services for people who have visual reduction due to diabetes. But we thought it was more important to look at, as you mentioned, the prevention aspect of it. So with help from Lions locally and internationally, as well as the Queen Elizabeth Diamond Jubilee Trust, we were able to develop a national screening and treatment program. So we're looking at educating the public on the dangers to your vision of uncontrolled diabetes. We're also looking at screening newly diagnosed diabetics or people who have not had a diabetic eye exam, and then providing treatment for those people where we can, because unfortunately, once your vision is lost due to diabetic retinopathy, you cannot regain it.
Cutting down on sugars, starches, and salt, and drinking unsweetened beverages and sodas, as well as natural juices or water, are some of the basic lifestyle changes that can be made. NARCI Director Dr. Candy Armstrong spoke on interventions that can be taken from a Ministry of Education point of view.
The majority of our children and young people are in schools. And the time when we can influence the most change is when they're at a younger age. And so there's a lot of responsibility and a lot of focus to try to do early intervention, early education, early sensitization, support at the early age, so that these things does not become habits that would be detrimental to their health.
We are even embarking on a nationwide screening process of public servants. We have done, I know, PG and independents. And we are going to go across the country, Ministry of Health, in tandem with the Ministry of the Public Service, trying to see how we can detect in an early phase diabetes and hypertension so that we can also do some levels of intervention there.
The theme for World Health Day is Step Up, Beat Diabetes. Dwayne Moody for News 5.